Everyone looking forward to August? It's only like literally just a couple of months. Can you believe
Freedom
I go
Day.
through this twice a year.
Hi everyone, and welcome to Anesthesia Coffee Break. I'm Lahiru.
And I'm Stan.
And today, we're going to talk about humidity.
Well, for everyone who actually doesn't know, and in actual fact, I didn't know either until literally the week before he left. I was like, when am I going to meet up again to do our next episode? He's like, oh, Stan, I'm moving. I'm like, what do you mean you're moving? He goes, didn't I tell you I'm going to Broome for 6 months? And I think there were a couple of emojis there that were like, what? And then he goes, oh, I'm sorry, didn't I tell you? I was like, no. So La is actually in Broome at the moment doing his sabbatical for 6 months. And what a wonderful place to go for a sabbatical. And La and I actually met, for those who don't know, La and I actually met in Darwin in 2013 or 14. Yeah. So I was a consultant there. La was doing his fellowship. And Broome, if you don't know, sort of exists on the same sort of latitude. And what that means is that it's very tropical and very humid at the moment. So I know that all of us are very, very cold at the moment, but Lara is up there enjoying perfect weather. But is humidity an issue up there at the moment?
Yeah, I mean, I was born in the tropics, so I think humidity just doesn't affect me at all. But, you walk outside and you start sweating. Now, interestingly, we'll go through this, but I was just looking up the relative humidity in Melbourne versus Broome. And it's actually during the daytime, it's actually about the same, around 40.
It's about the same. Yes.
Yeah.
Correct.
So,
and I think it's really important to actually tell everyone why the relative humidity is the same, but despite that, the humidity itself could be different. And the terms about absolute versus relative humidity, I think those are really interesting concepts. And so was this an MCQ question? I mean, was this a short answer question, La?
It's part of the syllabus, but it was a short answer question. I mean, I'm basing off some notes from a short answer question back in from 1994, but it's
right.
The principles in this are, the same principles. It's very finite what you need to know. So a really good topic just to learn and just be done with, really. And it's just really interesting because, humidity, it affects everyone. And the measurement the measurement of it is really interesting, and how it affects us as people is, in generally speaking, is really interesting as well.
Yep. And so the question from 1994 is compare two methods of measuring humidity.
Yeah, that's right.
And I think with a question like that, you do have to start off with the definition, especially with something, so conceptual as this. I don't think you always need to start off with a definition that defines very sort of common ideas, but this is a very specialized area, and I think it deserves a definition. So what is your definition for humidity?
Yeah, so really there's two definitions to talk about: absolute humidity and relative humidity. But first of all, absolute humidity is really just the amount of water vapor that exists in a given volume of gas. And so, that's really just how much water vapor is present. It doesn't depend on temperature, and you can measure it in something like grams water per meter cubed, or cubic meter, sorry, or milligrams water per liter.
How's that different from relative humidity?
Yeah, so relative humidity really just compares the absolute amount of humidity or water to the amount of water that would be in volume of gas that's fully saturated at a given temperature. So you've got, just the amount of water that's in a given volume that's dry, that's absolute humidity. But then you've got the amount of water compared to what could possibly be in that volume of gas at a given temperature. So relative humidity is a ratio, it's a percentage, and it's temperature dependent.
And that's a really interesting point. So go through again, what are the units for absolute humidity versus the units for relative humidity?
Yeah, so you can use grams water per cubic meter or milligrams water per liter. And interestingly, they're both actually the same number when you think about it, because if you multiply one of them by 1,000. So, you multiply milligrams water per liter by 1,000 to get your cubic meter, then milligrams times 1,000 equals grams. So the actual number is actually the same. So it doesn't matter too much. Now, when you convert to relative humidity, it's just a ratio of these two humidity numbers, which becomes just a percentage.
Great. And then the other sort of idea that a lot of people talk about is saturated gas.
Yeah.
And what does that mean to you?
Yeah, I mean, really, it's just the maximum amount of water vapor that can possibly be in that volume of gas at a given temperature. And, as you can probably imagine, the more temperature increases, the more water you can actually get into that volume of gas. So fully saturated air at 37 degrees. So think of deep in your lungs, fully saturated at 37 degrees, that's about 44 grams per cubic meter. Whereas say, just outside, fully saturated at 20 degrees Celsius, that's probably only going to contain maximum about 17 grams water per cubic meter.
Now, I know for a fact that was an MCQ question.
Yeah, it was, wasn't it?
Yes. So the fully saturated water vapor at 37 degrees, let everyone know what that number is again.
Yeah, that's right. So at 20 degrees, it's 17. And 37 degrees Celsius, it's 44.
And it's 44 grams of water per meters cubed.
Yeah.
Because they will try to trick you. They will try to trick you, and they will try to put 47 millimeters of mercury.
Yeah, that's right.
And there's a difference between partial pressure versus saturated, or the amount of water vapor that is actually present. Because one is talking about mass, one is talking about pressure.
That's so interesting. Yeah, I mean, just as I was revising this, I was like, oh, what's that 47 number? And just remembering that the alveolar gas equation really refers to, millimeters mercury. That's 47. And you're gonna have so many numbers just around your head. And it's really good to make this connection now that it's 44, not 47. It's 44 grams water per cubic meter versus 47 millimeters mercury.
Now, what are the ways to measure humidity?
Yeah, so I really find it interesting that, our exam, at least when I did it, it often gets you to describe quite old instruments that, we probably don't use now. I mean, these days, if you want to measure humidity, you've got special devices, electrical transducers, maybe in mass spectrometry, UV absorption spectroscopy, and you're not really going to be needing to describe those in a lot of detail. I mean, electrical transducers are probably easy enough to describe because you've got, probes is resistant and capacitance depends on the amount of water content. So you can easily manipulate that to get a number. But what is interesting is it really is interesting because you could talk about these three different instruments. So you've got your hair hygrometer, the wet and dry bulb thermometer or hygrometer, and Reynolds hygrometer, which is like the dew point system. And if you think of the hair hygrometer, it really is based on the fact that you've got, the principle that the hair gets longer as humidity rises. And so you could, the increased length is due to this, breakdown of hydrogen bonds with increased humidity. But then this could potentially be calibrated to a pointer to move over a scale, coupled to a needle gauge, and then you can read this off that scale. So a very primitive way of doing it, but I guess reasonably accurate for absolute.
Can I just point out?
Yeah.
If you guys haven't noticed, have you seen Lars' hair, especially his facial hair? Since he's moved up to Broome, it has grown so much longer than what I remember when you were back in Melbourne.
Has this got anything to do with humidity?
Mate, this is humidity at work. This is science at work.
You know what? The humidity causing laziness, causing me not to learn. That's what it is. So yeah.
Now, how about the other types of hygrometers that you want to talk about?
Yeah, so you've got your wet and dry bulb hygrometer. So this is really two thermometers, and one of them is a dry thermometer, and it just reads a temperature as normal. And then you've got the wet thermometer, and this one, imagine the thermometer where the wick, where the bulb is sitting in a wet wick, and so that means that wet cloth that's surrounding the bulb is evaporating, causing the wet thermometer to cool down. So imagine the situation where you've got one dry, one wet. The wet thermometer is going to be a lower temperature due to evaporative cooling. And then the less humidity there is in the air, that means that there's going to be a greater amount of evaporation. So the wet thermometer is going to have a further decrease in temperature. So you can relate this change between the dry and the wet, the absolute difference in temperature, and you can relate it to a couple of tables or some tables, and that can give you your relative humidity. So that's really interesting. It's a very simple mechanism, knowing that if you've got a very dry atmosphere, you're going to get a greater degree of separation between the wet and dry thermometers, whereas very humid, really humid weather means that you're going to get less of a difference in temperature between those two thermometers.
Yeah, and I think that's a point to make with the nomenclature. When we talk about the dry thermometer, we're not saying that it's in an environment where it's completely dry. We're talking about a thermometer that's in ambient temperature.
That's right.
Isn't that right? Yeah.
Because you're definitely just comparing a normal thermometer to the environment as it is versus one that's got a wick on it that's wet.
Yeah. Yeah. And so that hypothetically, if you had an environment where, you had 100% humidity, you would expect the dry and the wet thermometers to read exactly the same.
Exactly the same. That's correct. Yeah.
Yeah.
So
now, the third one, what's the third type of hygrometer that's important for us to know about?
Yeah, so this one's the Reynolds hygrometer or dew point hygrometer. And so it's this principle that condensation occurs when the air is fully saturated at the temperature that it exists in. So imagine you've got this tube, and so they usually have silver tube with ether, and that temperature of that tube is monitored. You then can cause the tube to decrease in temperature just by blowing air through it, and that reduces the temperature by evaporation. And once that temperature gets to a certain low level, then you'll see condensation. As soon as the condensation of the first dew appears, or the dew point, that means that the air just around it has become fully saturated at that low temperature. So once you do that, again, you can look up a table and go, the dew point temperature, we're getting, so you've dropped the temperature in that tube, you get condensation appear, and so at that temperature, you then go to a table and go, okay, what is the absolute humidity at that level? So then you can easily calculate the relative humidity by just finding out what the saturated vapor pressure would be in the ambient temperatures, or just taking the temperature, again, going to a table, finding out what the maximum amount of water vapor could be at that ambient temperature, and then you can also get relative humidity through that as well.
Yeah. Now, I remember having to learn about, the hair hygrometer and the wet and dry bulb hygrometer. And this was about, what was it, 2008. So yeah, 13, 14 years ago. So I think back then, things were black and white. We didn't have color TVs back then. And, we didn't have electricity. I think nowadays you're talking about, there are different types of hygrometers that are probably used, sort of thermal or resistive methods. And I would think that for the exam, those would be the ones that you'd probably have to know about rather than those ones there. I mean, what are your thoughts?
I think because these, it seems like in this exam, we learn about a lot of very old systems. Like, you learn about the Wheatstone bridge as a method of amplification. And I think these, like the wet and dry and the dew point, they just exhibit really basic physics principles or measurement principles. And I think that's why it's important to know them. They're relatively easy to describe, therefore relatively easy to understand. But then to go to the next level of, the resistance and, mass spectrometry and stuff, that just seems like the next level of understanding, which I don't think, in your study for this exam, I'm not sure you're going to know. But what do you reckon, Stan? Like, are there any other specific instruments out there these days that you could go through?
Look, there's obviously the new electrical ones that are out there, and I would think that for this exam, I would think that you would have to at least be familiar with how they work and at least understand, the physics behind them. And let me have a look at what they actually produced in some of the recent measurement textbooks, because I think that's probably the most relevant in terms of what we need to know. And also understand that this question was asked in 1994. Lara and I both sort of learned it for our exams. But as far as I can sort of recall, I don't think, hygrometers have been a question that has been asked recently. But I would think that if an iteration of that question was to be asked, and they did ask you about how humidity was measured, it is important to understand the mathematical concepts which Lara talked about. But in terms of, the ideas of the hair hygrometers or the wet and dry bulbs, it's a tough one. Hopefully it's not too difficult to, to sort of remember what Lara sort of talked about, but I don't think, hopefully you don't need to know that much into too much detail. All right. And I think, Lara, you also had some other things that you also wanted to sort of go through in terms of like the importance of the idea, which I sort of mentioned before, about relative humidity.
Yeah, I mean, when I was going through this, besides the fact that you've got these two measurements, what is the importance of it? And really, a big part of the importance of relative humidity, for example, is, weather forecasting, really. So having a high relative humidity just means that you're getting very close to saturation or full saturation at a given temperature of the air. Therefore, it increases the likelihood that you're going to get some kind of precipitation. So really, it's about weather forecasting. You might get increased chance of rain, fog, dew, whatever it is, based on a few other things as well. And it's really interesting to read up on that. The fact that you might have a place like Singapore or Broome where there's 100% humidity at times, but it doesn't rain because you need other weather conditions to cause that to happen. So I thought that was quite interesting. You need a sudden change or a cold front coming in to cause rapid movement of this air, so it causes particles. But then for us, I think the biggest thing is that the change in temperature that's perceived based on relative humidity is interesting. So the fact that you will start to feel more hot based on the fact that the humidity is quite high, because you just don't have that evaporative cooling that might exist otherwise if you're in a dry climate. So yeah, you definitely need to have the potential of evaporating by having lower humidity or lower relative humidity to allow you to feel cooler. But then
that's such a good point. And I think that explains sort of the differences in terms of why you can have 40-degree days in Melbourne versus 40-degree days up in Broome or Darwin and feel absolutely different between those 2 days. Like up north, it can feel very oppressive. And as you talked about, because of that high humidity and that inability of, your body to, sweat and evaporate, you just feel this immense heat. And very unlike Melbourne, where, at 40 degrees, you can, even though it feels hot, but you're still able to sort of head out and, do a lot of things that you like to do.
Yeah, that's right. And it's an interesting thing. There's more thermoregulation that once the ambient temperature rises above body temperature, the only way, besides behavioral things like moving into the shade, the only way to get cooler is through evaporation or evaporative heat loss. There's, your radiation, conduction, convection is all gone as methods of producing heat.
Yeah. Now, in terms of importance of what we do, what are some normal values in the airway?
Yeah, so at the deeper within the lungs, at the carina and below, you've got fully saturated water vapor. So the relative humidity is 100. So you've got that 44 grams per cubic meter, which is important to know. But also at different levels. So as you go further up, you might only get 75% saturation, so about 33 grams per meter cube. And there's I guess there's a bit of a, it's not really that known about what is optimal. So the body as it is has those values, but when we're ventilating someone, this is where it might get a bit interesting. The fact that, you want, especially in the ICU context and for longer cases, you need some, or even short cases, but you can't have zero relative humidity. You can't have completely dry air, because that inadequate humidification can lead to a lot of problems. You've got all that incredible amounts of water loss will occur. If that occurs, you'll have problems with ciliary function, therefore your immune function. You can get microatelectasis as well, and then your sputum, the stuff that your lungs are trying to clear up, will get really, really thick and might cause obstruction as well. And you might have body heat loss. So inadequate humidification in the clinical setting is a real problem. Then we go to the other aspect of it. So excessive humidification is also a problem, because you can increased water load can then also cause ciliary degeneration. It might cause pulmonary edema. You might change the AA oxygen gradient. You might decrease the mechanics of the lung, like the vital capacity, and also you might even decrease the hematocrit, because now you're just getting so much water that's absorbed through the lungs as well. And so, we have these methods where what would be really familiar to us is having that simple HME, that, heat and moisture exchanger, the filter that we just put on the end of the tube. And that's just a passive device. It just means that you trap some humidity, and it allows, in a very, cheaper fashion. It's not, super efficient. It doesn't give you the optimal settings, but it gives you an adequate amount of humidification to keep your lungs working okay. Whereas the actual mechanical, blow by or bubble through humidifiers, they are really efficient, and they can give you, really, really good levels of humidification. But again, there's not really that much evidence that this is much worse, and it can be a cumbersome device to have connected to your system as well. Now, a really great article in Life in the Fast Lane, which is a great source for all this kind of information. But really, the evidence, like their little evidence summary of HME, the simple ones versus the more complex devices, isn't that conclusive. So, you need some kind of humidification device to decrease the chances of, pneumonia and infections and mortality and, airway occlusion. But really, the heated devices and the HMEs aren't really proven to be more effective than one or the other. And there wasn't really a significant difference in, between these two devices on mucus properties, cilia transport over 72 hours in these mechanically ventilated patients. So I thought that was really interesting, because that's really where this comes back to in the clinical context. You need humidification. Lack of it causes a lot of problems. Too much of it can cause some problems, and you just need an adequate amount. And the evidence shows that, as long as you've got the HME on, which is what we do day to day, your patient's lungs are going to be pretty okay.
Yep. No, fantastic. Now, was there anything else like that you want to sort of go through?
No, that's about it, really. I thought we just nice quick section to summarize.
So just to summarize, so absolute humidity is literally the mass of water vapor in a volume of air. Mm-hmm. And it's measured in terms of the mass, so milligrams or grams in a volume, so whether that be liters or meters cubed. And then relative humidity is the ratio of the absolute humidity to that required to saturate the air at that temperature. Okay. And it's often given as a percentage. And then the key number that you want to remember is that the humidity, when you think about it in terms of our airways at 37 degrees, is going to be 44 grams per meters cube. And the ways that we measure humidity, so we've got so Lara talked about the hair hygrometer, wet and dry bulbs, and Reynolds hygrometer. I think the important things with those ones are that they would measure relative humidity, and then you need a table to actually work out what the absolute humidity is.
Right. Yep.
But then after that, you also have other more sort of modern hygrometers which can actually measure absolute humidity. So I think Lara sort of mentioned them in terms of mass spectrometers and UV light absorption as well. And also other forms of transducers. Okay, so that would be the headline summary of what you need to know with regards to humidity. And let's see whether we've got any sort of questions in the chat that
as in
sort of work through.
A few questions, but a lot of them have been answered. Actually, here's one. Say you took water vapor in an enclosed jar at 20 is it degrees, with an absolute humidity of 17 grams per meter cubed. If you heated that jar to 37 degrees, the absolute humidity in the jar would still be 17. Yep, that's right. It isn't influenced by temperature. On the other hand, relative humidity would decrease from 100 to 38%. Yeah, that's a really good example. If everyone wants to have a read of that. So just to outline that again, you've got an enclosed jar with 17 grams per cubic meter at 20 degrees Celsius. You heated the jar to 37. And so now your absolute humidity would fall because it previously was 100%. And then as you increase the temperature, now you've got more capacity to, hold humidity in the air. So the saturated humidity could be 44. So the maths would be 17 divided by 44 equals 38%. Great little example there.
It's an interesting one, isn't it? Because remember that when you talk about vapor is a substance in the gas phase that has to be sort of at equilibrium with its sort of liquid phase as well. So in other words, if you do increase the temperature, so in that example there, that example based, was on the premise that your water vapor doesn't change. In other words, your absolute humidity doesn't change. But I think that in reality, if you were to increase your temperature, your absolute humidity will change with regards to water vapor. But I understand the premise of that example there. Does that make sense to everyone? And does that make sense what I sort of described, La, when we're talking about water vapor?
Excellent. And so I think that's a nice, quick little summary of humidity. Hopefully we'll get a couple of marks on an MCQ or maybe a Viva question with that. So I think
that's great.
I think we'll close off for there. Okay, thanks everyone for watching, and really enjoyed having everyone here live. So yeah, please share this with anyone who might be interested, and we'll see you again next time for another episode of Anesthesia Coffee Break. Thanks very much. See you next time.